Have you recently turned 50? Or maybe you're already well into your 50s and starting to think more seriously about your long-term health. One question that might be on your mind is this: should I have a PSA test? Maybe you've heard mixed messages. Some say, most men die with prostate cancer. Not from it. Others say, early detection is key. So, which is it? Is it worth doing the test? Is it necessary? In this video, you're going to get clear, science-backed answers. You'll learn exactly what the PSA test is, what the results can mean when it's recommended, and most importantly, how it can potentially save your life. Let's start with the basics. The PSA test is a simple blood test. PSA stands for prostate-specific antigen. It's a protein produced naturally by the prostate, small gland, located just below the bladder, which plays a role in reproductive function. In a healthy man, only small amounts of PSA enter the bloodstream, but when there's a problem with the prostate like inflammation, enlargement, or cancer, PSA levels can rise. This rise is what the PSA test is looking for. But here's where things get complicated. A high PSA doesn't always mean cancer, and a normal PSA doesn't always mean you're in the clear. And that's where the confusion starts for many men. Let's talk about what causes PSA to increase. Yes, prostate cancer can push PSA levels up. That's why the PSA test alone isn't a perfect diagnostic tool. But despite its limitations, it remains a valuable first step, early warning sign that helps flag when further investigation might be needed. And today, we have better tools than ever to follow up on a suspicious PSA level. In the past, a high PSA almost always meant going straight to a prostate biopsy procedure. Many men understandably wanted to avoid. But now, we have multiparametric MRI scans, which allow doctors to see detailed images of the prostate. These scans are more accurate and less invasive, and they can often help determine whether a biopsy is truly necessary. Now let's answer a critical question. Who should get a PSA test? Most major health guidelines recommend that men between the ages of 50 and 70 consider PSA screening. Why this age range? Because that's when prostate cancer becomes more common and more likely to be aggressive. Testing in this window can lead to early detection. Early detection saves lives. In fact, large-scale studies have shown that men who undergo PSA testing are significantly less likely to be diagnosed with advanced stage cancer, and much less likely to die from prostate cancer. If you're a man in your 50s or 60s, and you're proactive about your health, if you take your well-being seriously, then test is something you should absolutely consider. Even if you feel fine, even if you have no symptoms, prostate cancer is often silent in the early stages. That's what makes screening so important. But what if you're in your 40s? For most men, routine testing doesn't start until 50. But if you're in a high-risk group, it may make sense to start earlier. This includes men with a family history of prostate cancer, men of African descent who are at higher risk of developing aggressive prostate cancer, men with elevated risk factors such as obesity or certain genetic markers. For these men, a PSA test in the mid to late 40s can serve as a powerful risk predictor. In fact, research shows that a PSA result taken at age 45 can forecast a man's lifetime risk of prostate cancer. Men with higher than average PSA levels at this age are statistically more likely to develop significant cancer later on. Let's break down what's considered a normal PSA level. In your 40s, the average PSA is around 0.6 ng per milliliter. In your 50s, it's about 0.9 ng per milliliter. In your 60s, around 1.2 ng/ml. Generally speaking, a PSA level below 3 ng/ml is considered normal, but this number should always be interpreted in context. Age, family history, and other factors all matter. That's why it's important to have a discussion with a doctor who understands prostate health. It's also worth noting that testing in your 40s comes with a unique advantage. At that stage, you're less likely to have BPH, which means any elevation in PSA is more likely to reflect a genuine risk. Catching a PSA trend early before the gland starts to enlarge naturally can help create a baseline and guide future decisions. Now, let's talk about the other side of the coin. When not to test, it may sound strange, but not every man should automatically rush to get a PSA test. For example, if you're over 70 in poor health and unlikely to benefit from long-term cancer screening, the potential stress and risks of testing might outweigh the benefits. Likewise, if you are not ready to take action based on the results, whether that means further tests or treatment, then doing the test might create unnecessary anxiety. Also, and this is important, there is no point in being proactive about prostate cancer if you are ignoring other critical aspects of your health. If you smoke, eat poorly, carry excess weight, and don't exercise, your overall health risks like heart disease, stroke, and diabetes may be even greater than your risk of prostate cancer. PSA testing should be part of a larger commitment to your health, not the only thing you do. So here's the bottom line. The PSA test is not perfect, but it's useful. It's most effective when combined with a discussion about your personal risk factors. It's part of a bigger picture of health. that includes lifestyle, family history, and long-term planning. If you're between 50 and 70 or in your 40s with risk factors, please don't ignore this. Talk to your doctor. Ask questions. Make an informed choice. Because when it comes to prostate cancer, early detection can mean the difference between a simple treatment and a life-threatening illness. And remember, taking care of your prostate is just one part of taking care of yourself. If this video helped you better understand PSA testing and why it matters, go ahead and give it a thumbs up. And if you're interested in learning more about men's health, be sure to subscribe and explore our other videos on prostate care, urinary health, and aging well. Take control of your health and take care of your prostate. You deserve it.